Hello and welcome back to the podcast, everybody. This is Harmony, your podcast host. Today, I have the lovely Kaths Baquie on the podcast, who will be talking all about sex after birth. Kath is a proud mama of three, perinatal physiotherapist, and founder of Fit Nest. So that's Fit Nest Mama. Kath has over 16 years of professional experience guiding mamas through their pregnancy fitness journeys and postnatal rehab, specializing in pelvic floor rehabilitation. Oh my God, I'm already like tongue-tied and we've only started. The pelvic floor rehabilitation. So today, Kath will be shedding some light on how your body changes through pregnancy and beyond, and how it can impact your sex life. Welcome to the podcast, Kath.
Oh, thank you, Harmony. Thanks for having me.
Oh, it's such a pleasure. And I know we were talking briefly before we hit record and we're both like, oh, it's just been such a big week and a big day, hence why I already stuffed up in the intro. But you know what? I'm not even going to edit. I'm just going to roll with it today.
Absolutely. And I apologize in advance. I've got 3 kids at home. You know, lockdowns are eternal here. And they're playing some sort of tiggy game and screaming in the backyard. And no doubt my 4-year-old's going to run in at some stage. So I really apologize, but hopefully not.
And he's so welcome too. So welcome on the podcast. I mean, we're talking about kids, right? We're talking about being mums and all of the things that come with that. So if that comes with a screaming 4-year-old into the it's fine. So I always start with my rapid inspiration questions. And my first one is, can you inspire us with what your superpower is?
Oh, you know, I've struggled with this and I thought I need to change this. I need to embrace a superpower and just bring it on. So look, I don't know. I think my superpower would be, and I don't know if this is a superpower or survival mode, but I'm a multitasking ninja. You know, I can make dinner whilst I'm folding the linen sometimes and then listening to a podcast and emailing simultaneously. And I don't know if that's a good thing, but anyway, that's what I do.
Ninja style, love it. And what's your favorite quote or mantra at the moment?
Something I say to my mums and members inside Fitness Mama is, and this is relating to fitness and exercising and having me time and, you know, having that time to ourselves, but it's something is better than nothing and done is better than perfect. So I'm like, you know, even if you do just 5 minutes of stretches, that's better than just doing nothing. So it doesn't have to be a perfect workout. Just something is better than nothing. Done is better than perfect.
Exactly. And inspiration comes from taking action, right? So
yes, that's right.
It all comes. And who or what is inspiring you at the moment?
Well, we were just talking off air about the lockdowns, and I would say I know lockdown's really hard on pregnant women, but I have had a few conversations recently with these amazing mums who are facing giving birth in a hospital without being able to. So my sister-in-law is facing having a baby in a hospital, and I think the partner can come for the birth, but then the partner has to leave to look after the other children and can't come back until pick up, it's time to go home. So I just think that everyone's resilience is really coming through during these times. I see it in my kids with remote learning. So even though it's a really challenging time, I think it is also inspiring to see how people are pulling together and adapting. So
yeah, beautiful. I love how you've highlighted that positive, because it is hard to find the positive sometimes in this kind of situation. But yeah, that is true. The resilience that people have bringing forth is amazing. And what does an inspired life look or feel like to you?
Oh, I love this question because I've never considered it before. But I guess if I'm wanting to lead a life where I'm always feeling inspired or being inspired, that to me, that is having the headspace and the time to be able to learn from other people, talk to other people. So whether or not that's conversations, podcasts, but always be trying to learn from other people. I think for me, that helps me lead an inspired life.
Brilliant. I love that answer. So, as I said, today we're talking about motherhood, the changes on our body, and how it can impact our sex life. To start it off, I would love for you to share your story into motherhood yourself. And how many kids do you have to start with?
Yeah, sure. So I've got 3 children, and my road into motherhood. So my oldest is now 8. I've got 8, 6, and 4. And I think my first pregnancy was beautiful. It was relatively easy. I thought, this is simple. Like, I can do this. And then my first baby, the recovery after my first baby was a bit of a shock to the system. I'd always prided myself on being quite fit and active, and I had been during pregnancy. And those first few weeks, I was surprised at the effect that childbirth had on my body. And I distinctly remember, I think it was about 2 weeks postpartum, I was feeling good. And my friend said, let's go to the cafe. And I was proud to show off my new baby to her. So off I trotted, I walked to the cafe. So a 20-minute walk with the pram, which for me, so easy. Like, that was not much. Sat inside the cafe, had my coffee or whatever. I walked home. I think I went via IGA and picked up some bread and milk on my way home. By the time I got home, it was 3 hours later, and I suddenly was walking back into the house, and I thought, my gosh, I've got prolapse symptoms. I had this pelvic heaviness. I felt like everything was just going to fall out of me. It was the most bizarre sensation. Like, it was quite a bit of a wake-up call. And for me, even though I felt great, I had overdone it for where my body's recovery was at. So yeah, that was a really big wake-up call. And then second pregnancy was riddled with pelvic girdle pain. We'd moved house, and I was looking after an 18-month-old toddler. So that was really challenging. And that was what really inspired me to create my current program for pregnant and new mums, because I thought there has to be an easier way. Like, I've got pelvic girdle pain. I'm struggling to walk. I'm struggling to exercise. How can we do this at home, in the comfort of our home, with our toddler running around? So being able to access stuff at home was where Fitness Mama, where that was birthed. Is that the right term? That was where the idea came to light.
It's like your other baby.
Another baby. It is. It's my 4th baby.
Yeah, it totally is. A business is like that, huh?
That's all right.
Yeah.
So yeah.
And can you just explain a little bit about Fitness Mama?
Yeah, sure. So I do home-based online workouts for pregnancy and postpartum. So pregnancy includes the pelvic girdle pain-friendly workouts. Postpartum includes a beautiful bit of a step-by-step strategy to help you recover after birth, whether or not you've had a vaginal birth or a cesarean birth. And I know a lot of mums do struggle at this stage. Like, when you have a baby, and I'm sure you agree, like, everything, your whole focus goes to the baby, doesn't it? Changing nappies, learning how to breastfeed, like, it's just your whole world is.
Yeah, it's crazy. I had twins, and so I was like, I just felt like I was a production line. Like, every minute of the day was consumed with, like, okay, feeding you, sterilizing the bottles. Oh, it's feed time again. Like, it was just constant. And it was, you definitely sort of focus, and you're learning too. Like, I didn't know how to deal with babies. I've obviously dealt with them at work as a nurse, but could hand them over. They weren't mine. I didn't have to really know how to do all of the other stuff with them.
Yeah.
So, massive learning curve. And that's what you're focusing on, is trying to be a wonderful mum. So
yeah,
it is.
But then sometimes, as a consequence of that, our own physical recovery gets forgotten about, or not so much forgotten about, but it's just put to the bottom of the to-do list. So I'm a huge advocate for postnatal rehab. I feel footy players rehab really well after a footy injury, and women, we need the same for our bodies. Like, we want our bodies to be strong and be able to support us throughout motherhood. And having that physical strength is super important for that.
Absolutely. And it's a big thing, like, giving birth.
Yeah. So I guess that's where Fitness Mama came into it. I wanted to provide these easy workouts that you could just do for 5 minutes or 10 minutes while your baby sleeps or while your toddler is running around next to you. Something that's is like what I said before, something's better than nothing. Done is better than perfect. And often they're the first steps you need in order to really just help your body recover.
Absolutely. So what are some of the big changes that our bodies go through during pregnancy and then the birth and then the postpartum window of, like, besides the obvious of growing a baby and expanding?
Yeah.
Some of, like,
Well,
from a physio point of view, what goes on?
yeah, and such a great question. And I could probably talk for hours. So I'll try to keep it succinct. I guess during pregnancy, the first thing that comes to mind, the physical changes. Like, yes, as you said, we are growing a baby. And from a physio point of view, this is when your pelvic floor muscles become under stretch. This is where your abdominal muscles are stretched. So our core, if we think about a core, which I know that term's thrown around loosely all the time, but our core, if we think about it like a cylinder or a can of Coke, at the base of the cylinder are your pelvic floor muscles. At the front of the cylinder are your abdominal muscles. So both of them have been getting stretched and weakened. And then at the top is your diaphragm, that big breathing muscle. And that's generally a bit out of whack and not at its proper length tension relationship. And then at your back, you've got all your ligaments and soft tissue structures and muscles. And with all the hormonal changes happening during pregnancy, often those ligaments have a little bit more flexibility in them because your body's preparing for childbirth and for that pelvis to widen, but it impacts your whole body. So if we think about the core, top, bottom, front, back, all 4 elements of the core are slightly weakened. And that's why the pregnant woman is potentially more susceptible to injury because her body's it's not at its optimal state, I guess. And there's changes happening in the center of gravity. There's mechanical changes, postural changes. Everything's a bit out of whack. So yeah, from our point of view, I think that's why it's really important to care for our body during pregnancy and adapt to a few things.
Yeah. And yeah, absolutely. And I'm just wondering, like, also the internal organs, like the impact on the internal organs. I know, like, when after my pregnancy, I had a really, like, my bowel was so much more sluggish. It's like it took a long time. And I know that's also got to do with, like, hormones and everything as well. But I feel like maybe with the twins being in there, they've really sort of, like, stretched the bowel or something. There's just, like, a lot more transit time. And then my bowel motility function was off. And I believe that was a big trigger I got SIBO, so small intestine bacterial overgrowth. And I feel like it was really triggered after pregnancy. And I'm just thinking, like, there's a lot of causes of SIBO, but I mean, and I did have a cesarean with my twins, which is sort of one of the factors of getting SIBO, any abdominal type of surgery. But I'm also thinking just the bowel motility function as well, just having so much in there pressing up against all of the organs. Do you think that is like...
Absolutely. So the earlier trimesters, I believe, it's not quite my area of expertise, but I believe it's hormonal changes that slow down the motility of the intestinal tract. And then in the 3rd trimester, you're exactly right. Your baby might be pushing against, like, there's mechanical changes. There's just less room. So yeah, definitely constipation is big with pregnancy. And that's one area that we really do want to try to prevent that straining on the toilet to protect our pelvic floor, and also to help protect against hemorrhoids and those sorts of things, which can be quite common during pregnancy. So if you are listening to this and you're thinking, oh yeah, I'm a bit constipated, more so than usual, don't put up with it. Go and have a chat to your doctor, and perhaps a dietitian to look at your diet side of things, because there's lots that can be done.
Yeah, absolutely. And yeah, it is very common in in pregnancy, just with the rise in hormones. So our estrogen and progesterone are at their peak, and they rise over the time of the pregnancy to support the growth of the baby and everything. So with that, progesterone in particular can cause constipation, like that high rise of progesterone. So yeah, definitely there's lots that our hormones do, but also like the high estrogen gives us that nice lush hair, and the hormones also help us have that beautiful pregnancy glow. So there's lots of good things, but yeah, constipation can be one of those not so good things. And also, as you mentioned, the increase in the relaxin, so our joints can become, and our ligaments, everything can come a lot more flexible. So just having to be really mindful, even like in yoga, like we do a lot of, you know, prenatal yoga, but when you're moving your body, you might find yourself almost more flexible but overstretching to a point. So it's definitely important, I think, to work with a trained professional when you if you haven't exercised or don't know your body in that way. So yeah, I think your program would be really wonderful for a lot of mamas out there, or mamas to be.
Oh yes. Talking about yoga, got a lovely physio who's going to do some yoga for the mums too, because I think that combination of yoga and Pilates is a beautiful combination.
Yeah, absolutely. It's so good. So let's talk about sex and pregnancy now. So in the later stages of pregnancy, when the bump is growing, the baby's growing, and you can feel Baba moving and kicking, it can kind of feel a little awkward having sex. And I'm sure that it's crossed many people's minds if having sex in the second to third trimester could impact the bub at all. So is having sex safe during pregnancy? And is there anything that a woman and her partner should know or need to be careful of?
Yes, great question. And you're right. It's one of those things I think women probably think about, but then they might not ask anyone about. So it's good that you bring it up. The main thing with sex during pregnancy, well, we need to make sure medically, if you haven't had any complications or your doctor hasn't told you not to have sex, generally it's fine to have sex. So there are a few conditions that the doctor screens for that they would tell you about if there were some issues not to have sex. But otherwise, it's a matter of working out what is comfortable for you. So from a physio point of view, which position are you able to maintain, or which position works for you? So lying on the back might not be ideal, because they tend to recommend not lying on back for long periods of time, and not lying on back for exercise. And the reason is the weight of the baby can push down on some of the blood vessels that supply the baby. So there is some research. It's a little bit inconclusive and it's a bit of a grey area, but to err on the side of caution, generally the recommendation is to not exercise on your back. And I guess that includes having sex, because it's a form of exercise. So the other thing to consider is during the later stages of your pregnancy, your cervix might be sitting a bit lower than usual, just because of the baby the big baby that's sitting inside your womb. So for that reason, you might find a position more comfortable where there's less deep penetration. So if you are noticing it's a bit uncomfortable up around that cervix area, that's where side lying might be useful, or having you in control. So whether or not you're on top, if we're wanting to talk about positions, because at the end of the day, whoever's listening, don't have sex that's painful. Like it's not good for your body. It's not good for your mind. You don't want your brain to associate sex with pain. So if you are having any discomfort, please do stop. Again, consult your doctor. And have a think about some different positioning, perhaps that might work better for you, or lubrication as well.
Yeah, excellent. And a common thing that I hear from women that I see in my clinic who have newly given birth, or even like 18 months after birth, they say that their libido is pretty much non-existent. And I know we can put that down to fatigue and the sleepless nights of having a bub, and also the hormonal shifts, because after we give birth, our hormones then drop drastically, like that they're going to be at the lowest point ever until you hit menopause or until you have another baby and they drop again. But it's when our hormones are at their really low point, and so therefore that can also affect our libido. But then for some women, it's also the fear of having intercourse too soon after giving birth. So how soon is too soon, and does the timeline differ for women who have given birth naturally versus women who have given birth via a C-section, and both of those without complications?
Okay, so again, this is something you really need to have a chat to your doctor about at that 6-week medical check. So they will make sure your cervix is fully closed, and they generally say at that point, yeah, it's fine for you to get back to having sex. So I generally recommend my mums not to have sex until they've had a chat to their doctor.
Mm-hmm.
And in terms of whether or not there's a difference between vaginal or cesarean birth, I believe it's still, if we're going to put a blanket rule on it, it's about the 6-week mark. But having said that, after a cesarean birth, some women are still tender around the tummy area for quite a few months. So this is where, even if you're told you can have sex at 6 weeks, I remember when my doctor told me that, I just was like, are you crazy? Like, why are you even telling me this?
Yeah.
It's the last thing you felt like doing. So just because you get told that you can have sex at any certain time, this is where I think communication with your partner is really important. Just being aware that, yes, it's your whole life's changed, your hormones are all over the place, you're sleep deprived. So this is where I do think it's the physical side is usually the easiest thing to tick off. And just on that note, with the hormonal changes, another, as you said, another effect is that it can cause, that low estrogen state can cause a dryness, a vaginal dryness. So I always recommend my mums, grab yourself a lubricant before you get back into having sex, just so that it's not uncomfortable with vaginal dryness.
Absolutely. And I love the point you brought up. It's like about like listening to how your body feels and how you feel. Like you're not going to get any great award for getting back in the sack straight away after giving birth. It's no race. And I think if you're feeling uncomfortable or the timing's just not right for you, then go with that. Like it doesn't, you don't need to feel ashamed or worried and if the worry is coming from worrying about what your partner is thinking or feeling, then maybe there needs to be sort of conversations with your partner around that as well, because you've just gone through, your body has gone through such a massive change, and your life and your mind and your hormones and everything. So it's not like things are just going to get straight back to normal straight away.
Yeah, exactly. Yeah. And what you said before about feeling a bit nervous, I can totally understand. And if that's the situation, again, communicate it with your partner and say, like, if you're ready to give it a go and the doctor said everything's fine, say, okay, let's give it a go. But if it's hurting, we're going to stop, and just like put that out there, saying we might not proceed if I don't want to. So I think opening up those lines of communication can also help to reduce anxiety, rather than thinking, oh my gosh, if it's going to hurt, we're going to have to keep on going.
Absolutely. And also there's like some women have through their birth experience, they might get vaginal or anal tears. So I guess that would really impact the timeline of, when you'd be able to as well, because ideally you would want those healed up. You don't want to be sort of re-tearing or
So generally, they're perineal tears you're referring to. So generally perineal tears, like first and second degree, they might be involving a few stitches, and then the third and fourth degree tears are when it goes into the either the muscle, the lining around the anal sphincter area. So they're the larger tears. But either way, if you've had a third or fourth degree tear, hopefully you're having some follow-up with that. I know quite a few hospitals have a perineal clinic for those women who have had those larger tears, so that you just get a couple of extra reviews. If in doubt, or if you don't have any of those reviews and you're listening to this and thinking, oh, I had a 3rd degree tear and I haven't had any follow-up, it might be worth, again, touching base with your doctor just to make sure the healing side of things going along well. If you have had perineal tear, 3rd and 4th degree tear, I would really recommend you see a pelvic floor physio. And again, in most hospitals, they will refer you automatically to a pelvic floor physio within the hospital if you've had a larger tear. In the ideal world, it would be amazing if every woman at the 6-week mark roughly could have a pelvic floor assessment. And in some countries, they're starting to offer this for all women. So hopefully in Australia sometime soon, this will become something. But if you can, financially afford it, or if you can't afford it and you've got concerns, you could get referred to your local continence clinic. So that's the GP that needs to refer you on. So it might be a larger wait list, but there is that option to have a pelvic floor assessment if you feel you need it. And so it's something to chat to your doctor, because it does vary a bit depending on where you live in Australia too.
And what about prolapse?
Just going back to the tears, the other thing, if you've had an episiotomy, so they've had to do a cut and a few stitches, or you might also benefit if there's a bit of lingering tenderness in the ongoing months. Sometimes something called episiotomy scar massage can be really helpful. And that can help with reducing the sensitivity around that area. So I guess what we're trying to say is, if you've got any concerns, just go and get that follow-up with your local pelvic floor physio, because they'll hopefully be able to give you a bit more of a structured, tailored plan for you. And then with prolapse, where do we go with that? So the first 6 weeks with prolapse, all about rest and horizontal rest. If you're listening and you don't know what a prolapse is, I described it at the start. For me, that was a feeling of heaviness, and that I felt like I had a ton of bricks sitting on top of my pelvic floor. But for some, you might notice it as a vaginal bulge or a lump. And sometimes there's more subtle symptoms, like feeling there's a bit of a tampon stuck, and even though you don't have a tampon inside you. So if you are noticing prolapse, again, I reckon that is one of those reasons to go and have a pelvic floor assessment if you can, because again, it's not something you necessarily need to put up with. Generally, there can be a management plan. You might not be able to fix the prolapse, but hopefully you can feel empowered and confident about how to manage your symptoms, or the options that are available to you for treatment.
Because they'd use in like some of the more prominent cases, like to be able to sling the prolapse up. I'm just wondering with like sex post-birth, if someone's had a prolapse, if that's possible. Like, how does that work?
So there's a few different, were you talking about the surgical sling it up, surgical options? So depending on what level of prolapse and how severe it is, you might not need surgery. It might just be that you manage really well with conservative management, so pelvic floor physio, learning about your lifestyle factors, making sure you don't have the constipation, because that can be a big risk factor for prolapse. And then there's even things such as pessaries, which is like a little silicone, there's different shapes, but it might be a little ring shaped pessary that you might be able to pop up inside you, like a sort of like a tampon, and it sits inside your vagina and helps to hold everything up. So it depends what sort of prolapse you've got. You can have you might have a prolapse where your cervix is sitting a bit lower than usual. Or you might have prolapse where your bladder wall, like your anterior part of your vagina, is flopping down a little bit. Might be a posterior one where your bowel's flopping forward. So there are different types of prolapses. So that's why it's good to get assessed, find out what type you've got, and then there's different management plans. So before I'd even consider surgery, I would want to make sure I've done all the options with conservative treatment, because let's say it is a more significant prolapse, they probably wouldn't look into any surgery until after you've had all your babies.
Yeah, definitely.
But I once, just on that note, I once had a 90-year-old, she was the most beautiful patient. This is a few years ago now. And she was referred to me from her gynecologist because she was too old to have surgery. And she had one of the largest prolapses I'd seen. And I asked her how she's going and how she's managing with it all. And she said, "Oh, yes, Catherine, I feel like I'm managing this prolapse really well. I just make sure I have sex with my husband." And, you know, she's like 90, 95, like she was pretty old. She was like, "I just make sure I have sex with my husband once a week, and then it pushes it all up again and I don't notice it for another week."
Oh, so sex can help prolapses.
So it's just delightful. But again, it's, you know, that's where you need your individualized plan. Yeah.
She did well with her plan.
Yeah. And sometimes if you have a prolapse, sex might be uncomfortable, but even if it is uncomfortable, there's some things that we can do to help with that too. So yeah.
Exactly. Awesome. So it's not like just because it would feel a little bit maybe at first, oh no, like when you're having that prolapse and that feeling like that you wouldn't be able to have sort of sexual intercourse because it would affect it in some way, but it can, by the sounds, be safe to do so. And
yeah, absolutely.
Like the lady said, helpful.
Yes, absolutely. Having a prolapse shouldn't stop you from doing anything you don't want to do. So there's always going to be hopefully some options for you.
Yeah, wonderful. And is there anything that you would suggest doing, exercise-wise or other, to prepare for a healthy sex life post-birth? I guess like maybe pelvic floor exercises, or we go on a lot about the pelvic floor and looking after that before birth and after birth. So yeah.
I think there's two main aspects. Yes, one, definitely every pregnant woman, new woman, I think should have a combination of pelvic floor exercises and core exercises in their program. So personally, I don't think going for a walk is enough. So walking is a great form of exercise, but I really do think we need to enhance that if possible, or, you know, add some pelvic floor and core to your program to really help support your changing body. And then in addition to your pelvic floor and core, it's not just about your pelvic floor and core, also the whole body strengthening and just making sure your body stays as flexible as possible, and you're being aware of your posture and you're knowing how to best support your body. So it's the two elements, the pelvic floor and core, but a workout plan or an exercise plan that works for you and your lifestyle. And this will be different for everyone. For some women, that means, you know, going to the gym. And for other women, it means doing 5 minutes or 10 minutes of stretches and exercises at your home whilst your toddler runs around. So for some it's going to the pool. So finding what works for you and something that you can be consistent with.
Wonderful. Thank you for all of your insight into that. It's been an interesting chat. Hopefully a lot of other women will find it interesting and know that, you know, it might just keep their mind at ease when they are going to take that step to have intercourse with their partner after they've given birth, because it can be like a bit of an unknown sort of zone when once you've given birth. Your body's gone through so much, and so much changes, and hormones affecting it, and the pregnancy affecting it, and the birth affecting it. So yeah, it can be a little bit confronting, I guess, straight after birth. So thank you for clearing up some of those questions for us. It's been wonderful to have you on. Where can the listeners find you, or if they want to join your fitness program, where would they find you?
Oh, thank you, Harmony. It was lovely to chat. So you can come and check out my podcast if you're pregnant or postnatal. So it's a Fitness Mama podcast. So it's FITNESTMAMA. And then Instagram's at Fitness Mama, and websites www.fitnessmama.com. So it's all the one sort of area, one name.
I'll put their website in the show links as well, so you can just click straight on.
Oh, thank you.
You're welcome. Thank you so much, and thank you to all of our listeners. Namaste.